3, 2, 1, needle pod. Ellie didn't want to do that kickoff, but I'm not ready to let it go. She just said, let's get started. Welcome to the needle pod. Team, we have a guest today. Our first guest ever. Clearly he's lost because the fitness athlete division podcast is down the hall, but we're going to talk fitness, but kind of specifically CrossFit. We'll get our needle questions in. And honestly, I mean, I don't think I'm even biased at this point to say like the fitness forward pendulum in PT, the barbell rehab is noticeable. The trends are there. The last 5 to 10 years, we just see more PTs kind of blending barbell rehab, the strength and conditioning, like the true resilience and capacity building stuff. And if you ask me, maybe this is a biased thought, but even before I was in the ice circle, there was one name, one guy that I saw out there, not just talking about it, not just bringing up kind of old school strength and conditioning research, but actually doing it, like living the life as a PT, owning a CrossFit gym, doing the training himself, but also, you know, having the skills needed to put out pain and all of that. And that person was Mitch Babcock. So in a minute, I want to hear how you got started with all of it, Mitch. But man, I just, if there was even, again, before I jumped into the ice circle, a reputation ice had, it was that Jeff was just a manual therapy guru, a Yoda of manipulation. But then it was you, to be honest, like it was the fitness forwardness. So feel free to introduce yourself, but I'd love to hear how you personally got started with all of that.
Well, that's very nice, Paul. And I appreciate that. Number one intro of all time for sure. But like, I think everyone would agree, like if you're anywhere, you're standing on the shoulders of giants, right? And like the one thing maybe I had the awareness of was I was very involved in gyms and working out through undergrad. Like that's the reason I picked my exercise science undergraduate. I just liked working out. I was just a gym bro, right? And doing gym bro things like chest day Monday, back on Tuesday, skip leg day on Wednesday, right? Like we've all been there. And so like in grad school, I had the awareness. I think I was doing a physique show, and there are embarrassing photos of me in a spray tan if you go back far enough on the social media. But like,
Man,
dude, yeah. Thank God you didn't have that knowledge prior to this podcast. But there was a moment there that I was like, this just doesn't seem right. I don't think I can scale what I'm doing. I don't think I can convince my mom that the way I'm exercising is also appropriate for her and longevity. And I certainly didn't feel fit. I can remember as I was at my leanest and like stage ready, I can remember feeling like this, I feel awful, right? This like things are not connecting for me. And so that was middle grad school. And, you know, the person that I drew a lot of inspiration from, and I know a lot of PTs have as well, was Kelly Starrett. I mean, he was the only person I could find, mobility wad, on YouTube that here's this guy doing CrossFit and talking about lacrosse balls, right? And just got wheels spinning, connected a lot of dots for me. And I remember him saying like, you know, in CrossFit, we do 5 rounds per time of overhead squats and 400-meter runs. And that's not much different than in physical therapy doing a timed up and go or a 5-time sit to stand. And you're looking at outcome measures for disease and decrepitude, individuals who are on risk of functional dependence or nursing home versus just extrapolate that out and say, well, how high or how far can we progress that functional outcome measurement in the terms of fitness? So wheels spun, started thinking about CrossFit, really adopted it as my personal form of fitness. And then that's where it was like, look, I want to find a way to do this for people. And I was so sick of hearing people, and I still am. This is a pet peeve of mine where people say, you know, like, you know, I'm the bridge between strength and conditioning and rehab. And I'm like, bridge what? Like, you
bridging
know,
the gap.
what? Yeah, what gap? Like that gap has been it's been covered, crossed in like at this point. There is no gap anymore. That's just the way things should be done, right? Like you should just be getting your patients loaded heavier and finding an opportunity to blend fitness into their rehab and finding an opportunity to help them live a longer and healthier life while doing it. And so, yeah, just getting really firm with that. Hat tip to Jeff as well for somehow watching what I was doing. And when I was making videos, I didn't think anyone was watching. I can remember being in my local Anytime Fitness with my iPhone, just like shaking and recording it multiple times over because I was so nervous. But, you know, those terrible videos got Jeff's attention, and dots connected for Jeff, where he was like, hey, we need someone to help other physical therapists learn how to do some of these movements and apply them to rehab. And off we went from 2016 till now.
2016, which, yeah, Jeff, I mean, if of all of his brilliant skills as a, you know, an innovator, seeing what's coming around the corner is probably his greatest gift.
Yeah, he's
so
pretty good at that.
that's kind of how it was packaged as Nice. But like I said, you don't just talk about it, you live it. I mean, right now, all of the hats that you wear, I mean, not even saying husband, father, dog dad, like you own a massive CrossFit gym. You're part owner of directly attached physical therapy clinic. You're teaching not only like online stuff, but you're out on the road. So, I mean, what does a week in the life, a day in the life of Mitch Babcock look like when it
It
comes to all that stuff?
it looks like unmedicated ADHD. That's what it looks like. Yeah. So own and operate CrossFit Fenton, which is, we're a small town CrossFit affiliate. We got 2 monthly members that are coming through our doors all the time.
That's huge.
And yeah, so like been on the coaching floor a lot over the last decade and coached a lot of classes and watched a lot of people move. And that's where I draw a lot of my expertise from, is like not just talking about deadlifts, but actually literally coaching regular humans on how to do them and do them better. And so at this point, I'm still on the coaching floor, roughly 10 hours a week. Just changed my schedule there, so my hours might be a little more conducive to a better balance. So that's cool. But yeah, anyone that knows owning and operating an affiliate like that comes with a lot of marketing, comes with a lot of kind of capture new gym members and leads and that sort of thing. So a lot of my week is kind of geared around that and growth and development of the gym. But also we've got the clinic, right? And so we've got 3 awesome physical therapists that work full-time over there in the clinic that really keep the wheels rocking and rolling at Health HQ. And thankfully I can stand back and just facilitate what they need and get out of their way. And admittedly, I treat very few patients now. When we were getting things up off the ground, you guys all know what it's like getting a clinic up and started. Ellie trying to start another one right now, right? So like you're putting in a lot of hours on that front end of trying to wear all the hats. Thankfully, I don't have to wear all those hats anymore. In the clinic side, I treat probably 3 to 5 clients a week, right? And so much reduced from a treatment capacity standpoint, but a lot of my regulars or gym members that were kind of request appointments. That's kind of what I'm doing over there. And then, yeah, been lead faculty for the Institute since 2016. So I teach on the road. I try to minimize that now that, I've got a year and a half son now and trying to make sure that I'm managing those weekends well. I try to get on the road at least once a month. So that puts me somewhere around 2 live courses a year. And then we're also teaching our level 1 online course. And that's much more conducive to home life balance, where I can just put the kid to bed and come downstairs and jump on a meeting at 8 p.m. and talk to some therapists as well. So yeah, ADHD is a good way to summarize it.
We know that. And again, Ellie probably even more than I do. Cause I mean, first of all, congrats. The pictures of your second location look amazing. And you're a part of Onward. So I mean, you guys literally take kind of what we're talking about today and put it like the weights, the barbells, the squat racks in your clinic. But obviously you have all of the manual therapy and needling skills. I mean, you personally specializing in pelvic, apply all of that to even another kind of subcategory of PT that otherwise probably wasn't doing it. And I know you have been highly competitive in so many things, Ellie, but currently you crush me on every CrossFit workout we do. Give us your background kind of in when you started treating the way you do, but also when did you start training like that yourself?
Yeah, so I was always an athlete. Like I grew up competing in freestyle skiing. And so with that came injury and with that came physical therapy. And then from there came like, how can I make myself more resilient? And so I found the gym, the strength training space in the rec center in undergrad. And was just doing kind of traditional like squat, deadlift, squats way above parallel, like not squatting appropriately.
You got some long femurs. You got some long femurs.
Not really knowing what I was doing with dosage, but I did do exercise science and CSCS right out of school. And then from there, started doing more physique style training. I was in PT school. I met my husband, who is more of the hypertrophy style trainer, or like that's what he does for training. And so that's where I fell into more of a love with the weight room, but doesn't always translate to life, I think, too. And so I actually found CrossFit, which is now my primary mode of exercise. When I was pregnant with my first kiddo, I took the clinical management, the fitness athlete course, which at the time was called clinical management of the fitness athlete, when I was 22 weeks pregnant with my son. So again, learning the snatch and how to properly do the clean and all of those things was definitely challenging with a baby bump.
Modified bar bath for sure.
Yeah, still working on that, still unlearning some of those poor habits. But then from there, progressed and actually I joined an affiliate when I was 13 weeks pregnant with my second kiddo. So there was kind of this space where I was in 24-hour fitness and doing more of this metabolic conditioning, relearning overhead squats, snatching with a men's barbell, all of those things in a just 24-hour. And then got into the pelvic space when I was pregnant with my son too, and was trained very traditional pelvic of a lot of things happen on the table. We're doing Kegel weights, like actual intravaginal weights and things like that. I'm like, that's not super functional for it. So then I found the pregnancy and postpartum course with ICE as well, and started implementing some more of the like translating that fitness athlete world to the pelvic space about 6 or 7 years ago or so. And so it's really just evolved from there. And then especially since I've only been doing CrossFit myself for about 4.5 years or 5.5, I don't know. It's hard to calculate pregnancy and when all that happened, but my practice has even evolved since then. So typically like a day one session, what it looks like for me with my pelvic folks is we start on the table, we end with a deadlift, no matter what. We're always kind of getting, how do we actually brace and load the pelvic floor with an external load? It's really cool to see that evolution of my personal exercise and then also how that's changed the pelvic space. And I think that's really where things need to be going with pelvic. So yeah.
That barbell clang in the background was a paid actor. I don't know if that's Brian, if you just told him to throw around some weights in the middle of, or
I didn't even notice.
If it's a patient, but you were deadlifting. You had a course in Longmont this weekend, and you guys were deadlifting on the course. I heard there was some PRs. What did you lift?
Mine was not, I don't know what my 3 rep max is, but I always try and do some sort of deadlift at that spot. It's such an amazing facility for those that haven't gone out to Longmont. It's a huge gym. I did 315 for 3. So my 1 rep max is 345. I can hover at 350. I can get it off the ground. But yeah, there was a bunch of women PRing, like all the chicks were PRing, which was so cool to see. We had some chick hit 275 for 3 for the first time. Someone else hit 195. And before that, it was 165, like these huge jumps, So that was really fun. And what was really cool is we had 100% participation both days of our workouts. So really
love. I mean, if you've never taken an ICE course, we do a workout, and I mean, it's not heavy deadlifts all the time. It's you can scale it to whatever your skill level is. But I mean, what I love about our 3-day courses, Friday, Saturday, Sunday, is we send 2 workouts, and Washington's the same thing. And the 100% attendance is one of my favorite metrics of the weekend. I mean, let's say even 60% were expecting a workout like that, but very clear with the eyeballs and the body language that 40% were not expecting to do a full day of con and then lace up the sneaks and go right into a workout afterwards. But man, that is one of our favorite parts of every weekend. I mean, obviously you guys do it with Fitness Athlete, but any ICE course that you show up on is going to be like that.
Well, and that's a better image of what's happened with the profession. And if you don't know, and if you're listening to this podcast and you're like, what are you talking about? The profession is going that way. And I can say this from like back in the day, like 10 years ago, workouts after the course that's not what we did. Fitness Athlete did one because you needed to have an awareness of what these individuals that you're going to be treating. If you want to treat the CrossFitter, it's kind of a good idea that you understand a little bit about what that's like. We can talk about technique all we want. Let's put you under some cardiometabolic duress and let's see how well your squat technique looks now. Okay, now that we have that awareness, we can better speak to that athlete. But in terms of like the wider breadth of our coursework, we were not instituting mandatory workouts. And then there was a pretty good shift where like Jeff was like, hey, this is the way, and our company is going to stand firm that we are going to work out. But it was always optional. And by that I mean like preferred optional, right? Like, hey, you don't have to stay for it. We'd like you to.
A little peer pressure, but
yeah, like we're going to know if you don't, put it that way. But like you don't have to. And even then, during that early evolution, it was like, hey, I only had 4 stick around for the workout, but hey, here's a picture of us, But by nature of consistently and just beating that drum year after year, course after course, 60% attrition, 80%, 90%. Now you're hearing Elli like 2 days back to back, 100%. Everyone's doing the workout. The profession has just shifted along with media and information and longevity, and people are more health conscious now than they were 10 years ago, I think, in general. But definitely the physical therapy profession has really made a shift in what we feel to be a good one, which is like, hey, be about it. We put it on our shirts, we put it on our website. Like, if we are going to be the profession that says we think you should move and move more and lift weights and be strong and be robust, we also are going to do it. And not just, we're not just going to talk about it in the clinic. We're actually going to do it even on a Con Ed weekend. We're going to sit, learn, stick needles in each other, crack backs, learn how to deadlift. And at the end of the weekend, we're also going to drop our stuff and get a workout into. So that's been really sweet.
Hell yeah. And Mitch, I don't even know if you remember this, but specifically my invitation, my first experience in CrossFit ish stuff was with you. And I actually,
How could I forget, Paul?
been, been an athlete most of my life. I was actually that dude that thought I was still pretty fit. I would walk around the big box gyms 3 to 4 days a week, get my 3 sets of 10 in. And then, I was actually in the middle of COVID. I was with the ice crew in Hendersonville, and then we did the Con Ed all day. And then it's like, let's head over to the box and we got a workout. I assume you drew the short straw because I not experienced CrossFitter, but you were my partner in a partner WOD. And I mean, competitively trying to keep up with like Joe and Zach and like everyone else. And
we pushed them.
I spent the majority of that, it was probably only 15-minute workout. It felt like 45. I spent the majority of it wondering if I was going to pee or puke or pass out. Like it was an unhealthy, like visceral, like executive functions were not guaranteed. And that was my first experience with CrossFit. And then we came back the next Monday after that weekend, my wife and I, my wife who was also pregnant, we joined in CrossFit. The rest is history.
The rest is history. It must not have been a terrible experience if you joined that next weekend, but it's a lot like, it's okay. I don't do jujitsu, but I got a decent gist. Like, when you survey the room and you're like, blue belts are partnering up with blue belts and purple belts, and it's like the one black belt is like going to grab the white belt. You know what I mean? It was kind of that moment of just like, hey, Paul, I got you, bro. Like, it's going to be fine. And like, everyone's like, oh, I don't want to partner with Mitch. And I'm like, why? Like, I'll do more work for you. It's fine. Like, I've been here, I've done this. And so I can remember Paul being like, dude, I don't think this, Paul, it's going to be fine, bro. Like, it was handstand push-ups. I think we had toe to bar, clean and jerks. We had the gamut, and the whole crew was gassed up to do a workout that had a lot of moving parts. And Paul was just like, you got to walk me through all of this.
I think we were warming up barbell. Must have been a clean and jerk because I concussed myself before we started. I mean, I caught my chin on something, and then it was everything you just mentioned, which I was not prepared for.
Key point of performance: get the face out of the way of the bar. We'll cover that later.
But we've been doing it ever since. And I mean, I'm sure you hear it all the time. It's like, again, for someone who thought I was pretty healthy, but I still, traveled a lot, maybe wasn't the healthiest with the diet. I mean, I was on the road of high blood pressure. My doc was trying to get me to take medication. I mean, there was a decided shift for me when we started doing CrossFit. And it's not just like a higher level of fitness. It's health and capacity and everything that we teach. So my N of 1 is very powerful. And I mean, I will continue to do it in some form until I'm that 60-year-old dad trying to keep up with my high school kiddos.
And I say the same thing. I'm going to be 75 doing this, and it's not going to look like it looks like when I'm 35, right? But I'm going to do CrossFit style methodology, scale appropriately for my physical and psychological tolerances until I can't move anymore. And so, I get the unique opportunity. It really is a blessing to teach a course that gives people this opportunity to like experience that. Because it is an exposing moment that is very black and white in that moment. When you finish your first workout, there's internal dialogue going on of like you said, I need to do a lot more of this. And you're either going to go into that and say, this fundamentally is what my body needs and is craving. I am missing this heart rate zone, this intensity, this volume, this capacity that other people clearly possess that I do not. Or the other one is I'm going to turn and run as far away from it as I can. And just like, but like that's, deep down, that's not the right route, right? But like you're uncomfortable right now, and it's like fight or flight mechanism is going off. And like we hope, and most people do, they're like, I need to lean into this. And thankfully, what we've heard from a lot of clinicians is like, thank you for making my first exposure something that was very approachable. And I think that's what a lot of people don't understand about our fitness athlete course. They think they need to be a fitness athlete to take it. And the inverse is actually more true. It's like, it is more suited for the person that doesn't know what's going on. Take our course. Let me be your tour guide, your shepherd for this first journey, because I know what areas you probably are strong in. I know the physical therapy textbook. I also came from the same pedigree you did, but also I also know what you're missing, right? And I know what movement you haven't experienced and what coaching you haven't done, and how to be able to scale that down, find a good entry point for you, and let you build up naturally. And so you walk away from the weekend feeling like you did, Paul, of like, I might have got my face beat in a little bit, like physically, literally and metaphorically, but also, I feel like I can start a gym now. I feel like that next step doesn't feel so big because I've got a decent understanding and awareness to me now after that weekend.
Which I've taken both the online and the live, and I agree with all that. I mean, whether you want to work with CrossFit athletes, you need to develop the coach's eye, speak the language, that sort of thing, or even get the programming components. I mentioned to you earlier, like my biggest gap as a new grad was I had no idea what I was doing, even with exercise prescription. I mean, we always kind of land back into 3 sets of 10 or like, oh, that was too easy. Let's do 15. I had no idea what I was doing. The rehab EMOM, setting up 1-minute segments and each minute has a goal with a specific exercise. If I would have had that one tool right out of school, that would have like filled the biggest gap that I felt. And that's just one thing you guys cover, again, online or live. And I love what you guys are doing now. Like, I think you just announced it last week, is like, you don't need to be a CrossFitter to show up to Fitness Athlete. And whether it's you doing the movements, knowing how to do the movements, or even being able to lift a certain weight, you can basically take the course as someone who knows nothing. Like, I'm here to learn the basics, like build a foundation, all the way up to kind of that RX, like, the language, you work with maybe a higher performing clientele. Like, you can take the same course, same weekend, you can almost take it multiple times from kind of that point of entry to like down the road. So I'm really cool to see feedback from cohorts on that, because that's brand new.
It is, and it's more of a terminology shift than anything, right? The content's still very the same, but this allows people to wrap their head around it in terms of like what we're gonna just put 3 main buckets, right? Like RX, scaled, or competitor. In like, as a therapist, right? If we use Elli as an example, Elli would be a good example of going through the course the first time as scaled, right? She was 22 weeks pregnant, boss, right? And still like, she's going to ask for modifications on, hey, like, I know you're covering the sumo or the conventional deadlift, but I've got this belly bump. So what modifications can I make? Or I know that they're doing, they're going over the kipping pull up right now, but where I'm at right now, I don't want to be on the bar and kipping swing. So what can I do? So there are ways to approach that course that we are going to just very clearly list out, like, hey, this is the content we're going to cover. And here's all the ways, if you want to scale the weekend, quote unquote, scale the weekend, that you can have nice modifications to go through it, get a great learning experience, get a good physical exposure at a current level that you feel comfortable with. And then RX would be like, you're doing the movements, right? Like you're going to do all the barbell movements. You're going to try all the gymnastics movements and move through it and need appropriate coaching all the way through. And then the competitor is like that person. Let's say I took my own course, right? I'm an affiliate owner, a therapist. I do this. I nerd out on this stuff and I exercise this way very consistently. I want to take the course and I'm looking to get from the instructor some higher level cues, higher level Olympic lifting analysis, or gymnastics breakdown, bar muscle ups, that sort of thing. How can we also service that individual? And so that's what we're just trying to do from a terminology standpoint, breaking it down, scaled, RX, and competitor, and letting clinicians know, like, wherever you're at, you're going to have a great experience and get a lot from the course. And like you said, Elli, where she's at now, retakes the course, she's going to have a whole different experience than the first time she took the course.
For sure. Yeah, that'd be awesome to retake it. I think that would be very interesting to see.
Just think like your Olympic lifts now, for example. Like you said, the first time you had taken it, you had never Olympic lift before. And so what?
I probably had never squatted below parallel. Let's be honest.
Let's take it back one step more.
Yeah. A couple no reps in there.
If I use the martial arts analogy too, it's like if you're a white belt, I can't give you black belt cues yet. It won't make sense. And I've used that in the gym a lot too. It's like when you're a white belt, I have to give you white belt cues. I have to make the thing an analogy very similar to something else you're familiar with, break it down in very simple terms, and get the movement looking a lot better very quickly. But when you come back as a blue belt, I don't even know the belt system. I really should do some research on this. I'm sorry.
I'm not positive blue is in there, but I mean, it sounds higher than a white
blue
belt.
might not even be a color. But when you're a higher level belt, right? My apologies to all those in the martial arts community, but when you're a higher level belt, you're looking for those higher level cues. And so when you retake something and you're doing the same movement, but getting a different set of eyes because you're at a different point in your journey, there's more cues to be had for you there. So blue belt or not.
We lost the Jits crowd a long time ago.
Yeah, me
Don't
too.
worry. We have to ask our dry needling questions. And I
Yes.
mean, I've been needling lots of folks for a decade, but for different phases, I saw lots of kind of people like me, kind of the low performing CrossFitters with the nagging injuries, but I also treated some higher level CrossFitters. So, I mean, I feel very confident with my sample size to say CrossFitters love needling.
Big time.
You have a way larger sample size. You see 200 people every week, which I mean, I love your context of like, we need people that do the one-on-one physical therapy, but man, if I'm going to do the biggest life-changing thing for the most amount of people, that's why I love being on the other side as a coach in your CrossFit gym. But I want you to poll your audience right now. How many of your gym folks, your CrossFitters of every level, do you think have tried dry needling, and what are the top things they're getting needled for?
Man, so Health HQ has been next door to the gym since our official opening was 2019. Okay, so we've got us going on 7-year runway there of being there, being available to those gym members, and a lot of our members are tenured long-term members too, right? I don't think saying a number like 50% is unreasonable that have went through and gotten at least some work done, well, shall we say, over that time. And I don't, I'm really trying not to short sell it, but I think that's a conservative estimate there that 50% of our members have already come through, maybe more than that. And yeah, needling's probably part of their thing, and a lot of them, they just know its effectiveness, right? They talk about it. They market it for us in the gym. Someone will be talking about their nagging elbow or shoulder or something after class, and they'll be like, "You need to go get needled." And I don't even have to say anything. It's just like, "Yep, let me know when you want to schedule," because they know that, like, in terms of like effective tools, that one's pretty high up the list, right? Like, and so if it's going to nag you for a while, you might want to go and get it checked out and maybe have needling part of the intervention. So yeah, it's in terms of like what we're needling a lot, right? Like, it's shoulder still leads the way, right? And that's in line with the CrossFit research as well, of like what areas are most likely to get injured in CrossFit. If they do, shoulder and low back seem to be outpacing the way, and that doesn't surprise anyone with how much the shoulder's involved in CrossFit. So yeah, we needle a lot of shoulders in the clinic for sure.
Love shoulder needles. And Ellie, I know you needle 100% of people that come through your door, but I also know
Yes.
you go to class, you're surrounded by people. And I mean, maybe a podcast for another day. I actually don't. People find out eventually, but I don't come in saying, "Hey, I'm Paul. I'm a physical therapist," because I just hate people being like, "Oh, my elbow, my neck,
Right.
like." I'm here to work out, kind of
Under the
not
radar.
talk shop. But I know people, once they find out, are going to talk shop. So in your gym, Ellie, same questions. What do people walk up to you asking about needling for?
Yeah, well, being that I'm in 95% of the pelvic space, I would say I probably see most of the gym members for pelvic related things. And then Brian, my husband, sees a lot for the ortho stuff. But yeah, we've had a bunch of people coming in, and dry needling is always something we implement, no matter really for 95% of the patients that come in. I think dry needling is part of their plan of care. And so we have seen plantar fasciitis that resolves super well with their plantar foot pain, right? That resolves really well with dry needling in a couple sessions. So that's a big one, I think, in CrossFit too, outside of like shoulder and low back. And then we also I think there's so much in not just the recovery space for for CrossFit, but also the mobility space. So at the gym that I go to, there's a ton of folks that just can't access range of motion and things like that. And so where you can get a really amazing, neuromotor reset, helps with proprioception in the joints, helps with just creating that window of opportunity to then go mobilize and load and improve their mobility, I think is something else we see in that CrossFit, like how dry needling can be effective in the CrossFit population. So yeah, we see it a ton. I think the biggest thing, our gym, it's not like the gym I go to is not huge. And so we actually have, 4 other gyms in the community that we draw from as well. So we don't have that direct connection that you have at Fenton and Health HQ. So yeah, so we see people kind of from all over the Fort Collins community.
And your division of labor is like, I'm too full with pelvic. Anything else that hurts, go see Brian. I mean, I know you have a team of PTs now, but again,
Yeah.
I know the research Mitch is talking about. I mean, having cross-fitted for a few years, my back breaks down, my shoulders. Like I have felt the things that people tell me about for sure. I'm over 40. I mean, I get it. And I've always had this question, and maybe we're not years, maybe our sample size's not large enough, but I mean, you two are the people to ask this is, I think Mitch even said it is like CrossFitters look for that thing that'll make them feel even a little bit better quickly, immediately. And I mean, historically, that's grinding in with a lacrosse ball. It's going to get a massage. I mean, Erosti has been a sponsor for CrossFit games for a decade. Like the thing that they can walk in, directly target a certain tissue with the goal of making it feel better or less injured, more healthy, has always been a goal of a CrossFitter and other populations. Let's talk CrossFit. Now that needling is more available to these CrossFitters, have any of those trends changed? And I'm fine if the answer is no, or we don't know, but are we replacing other things? Are we improving, like complementing other things? Like when we add dry needling to the CrossFitters bag of tools, what has shifted in the last 5 to 10 years?
Yeah, I don't do any scraping, right? Like tool assisted soft tissue. Like I'm not even sure we have one in the clinic anymore, to be honest. But like that, so and I can only speak to my practice on that. Like needling has completely replaced, that from a soft tissue management standpoint. We do a fair amount of cupping and myofascial release with cups, and so that's been helpful. But I would say that they coincide together more than they are one versus another. Now there are people that have needle aversion or whatever, and that may stay away from that. But for the most part, like man, the needling has been so effective so quickly. We talk about it giving a window of opportunity to go load it. More so than that, it's a buy-in window for my patients that look at me and they come in maybe a little skeptical that PT is actually going to help what they got going on. Bang, that dosage of needling and that big change within session, their eyes go wide open and they're like, what else you got for me? And then we go in the gym and I'm like, you have to get this cuff stronger. I can't just needle it for the rest of your life. Now I see them actually doing their shit, right? Like, and actually getting their rotator cuff stronger and doing their homework. It's almost like the thing that rattled them that said this thing can get fixed. And if you listen to me, this is the road to actually fixing it. So that's been really sweet. Now, I don't see many people doing anything effective with a foam roller these days other than lounging on it. So foam rollers have certainly lost their luster. And lacrosse balls are just kind of like, just like killing time until you can get needled.
But every CrossFitter, or a big percentage, I mean, if your gym is like our gym, is like, man, it is like a kiddo with his blankie. Like, don't take away my foam roller. Like CrossFitters have perhaps an unbalanced attachment to the thing that they can lay on and roll on. So I'm with you with the science, but man, that's why I asked this question. It's like,
I want to speak to that a little bit. You made like a really good point too of creating that buy-in for then loading things. And what's really cool about what I've seen in the gym transition since getting some of the clients from the gym into our clinic is that instead of lacrosse balling it, they're doing their exercises. Like, and I think that's where they see that the bigger change in loading it compared to those more passive modalities like foam rolling and lacrosse ball. And then it does give them that time. I think everyone could benefit from needling like setting up a plan and doing some tweaking with needling throughout their athletic endeavors. And so having the exercise as like that interim of how to get us to that next kind of session and seeing even if we don't need needling going forward, so.
Yeah.
And like it or not, we're in an information war, right? With trying to be the source of knowledge for the patients that we want to serve in our community. And so if I'm up against TikTok and Instagram reels for how people can self-manage rotator cuff tendon, you know what I mean? And the only thing that reel and thing can offer is how to roll on a lacrosse ball. And if the thing that I offer is you have to actually physically come in my office to receive this intervention, which is i.e. dry needling, then I get them in front of me. I can showcase the change and then they listen to me versus that TikTok or that reel on the internet, and so that you're actually delivering them the dosage and the thing that they actually need for their condition, not just this other person online said to try this stretch. It's like that's the real battle we're up against with people today.
For sure, dude. 2 guys in my class, like I do the 330 class. We have our little group, our CrossFit weekly group. 2 guys are doing their rehab from ChatGPT. And I mean, honestly, I've looked through it and it's not a bad program. Like if I were just to like write an email it's thorough, and I mean it's what we would do. So yeah, that buy-in is important. I mean, quick buy-in. Like if there's been from the 60s, whenever PT was born, a curse is like we weren't the quick fix, but now we're getting some modalities that are. And I mean the layer that I'll add, hopefully I don't stay on the soapbox for too long. This could be a whole nother like research discussion, but dry needling research will always only give you short-term results. That's the point. I mean, you can't expect 1 or 2 sessions or a weekly session for a few weeks to equate to 12-month follow-up. That's not how it works. But I love when Jeff talks about, because he has had the same arguments for manipulation over the years. He's like, none of our patients are coming in saying, you know what, I don't care how I feel today or this week or next week. Like, I'm really here for how I feel 12 months down the road. Give me one intervention. We know that answer is lifestyle modification exercise. We don't need more research there. But our patients are looking for, and they have lots of options, and they're looking for the thing that's going to make them feel different, feel better fastest. So we do need those tools to put the fire out, so to speak, to address their ground zero. I'm very biased, but the reason I am very biased now versus very skeptical for needling when I first started doing it is I've seen those changes, and I've had those patients that even still are skeptical about it. But then, man, like I live in the NFL realm, and I mean, if it's not me just doing test retest or asking my athletes how valuable our sessions are, it's them continuing to pay me to fly out to them. Like I don't need them to say anything. Like if they didn't see value in it, they wouldn't be hitting me up to get on a plane to go do the thing. Like I know that the research-based crowd is like, that's empirical, that's anecdotal, but man, when you hear athletes that are looking for that 1% advantage or that one tool that makes them feel the best or that helps them the most, that's what we need to be doing. And if needling's one of those things, we need to have that as an option. Because guess what? If we take the athlete layer off of it, Gladys, who has hip pain or back pain, if we don't have this one more thing, once she's failed conservative therapy, she's jumping other tracks for pharmaceuticals, for injections, for surgery, or she's just going to say, I guess I can't do dance class. I guess I can't go on my daily walk. None of those in truly 6-month, 1 year, life-changing context, none of those are better options. So, I mean, I didn't think we'd go there today, but thanks for allowing me to speak on it.
You're welcome. Yeah, we're all better for it. And yeah, like many of us that don't get to experience the NFL reward, right, which is watching guys actually play that next week that didn't think they were going to, we get to experience the reward of pulling people out of the medical system that were thinking about entering it. And everyone knows what cascade of mostly negative things that are going to happen once we lose them. Failed PT is a very dangerous road, right? And like if needling is one thing that can help someone stay engaged in therapy and stay out of the industrialized medical system that just wants to MRI, cut, solder, cement, fuse, right? And then like it's an intervention that needs to at least get an opportunity to see if it can make change. At least give your patient that opportunity and see if it can make enough change that they stay the course with you and not someone else's course.
Hell yeah. That's probably the best place to end this one. I mean, I was going to steal 30 minutes of Mitch's time. Mitch, when we sign off, I want you to give us places to find you being social. But if anything we mentioned about you're a physical therapist, you want to get into for a first exposure or get deeper into this whole working with CrossFitters or even just applying those principles to your patients. I mean, honestly, it's awesome, but I feel like your fitness athlete division gives away a lot for free. I mean, you can sign up to be on their feed, which gets, fresh data, fresh research every week. You have a podcast yourself where you kind of talk this in different contexts, just like we do for needling. There's online options, there's in-course options. So if this is piquing any interest for you, it's not hard to find, especially on the ICE platform. So Mitch, thank you so much for your time. Give us where we can find you and any final thoughts.
Well, final thoughts, I got to say, you guys are incredible instructors. If you've not taken, and if you're listening to this podcast, you've probably taken a course from Elli and Paul already, but if you haven't, get to one, because the only reason I'm having success at all with needling is because of you guys and your coursework. So an outstanding job with that. A quick plug of my stuff. Look, I'll tell you this. If you're a physical therapist that is listening and you don't have barbell knowledge. You don't feel comfortable with what a deadlift should look like or how it should feel. Maybe you're even scared to bend over and do a deadlift. At some point, you have to cross this bridge. And it's best to do it with us who are fellow PTs. We're in the game with you, and we can coach you through it exactly the way it should be done so that it doesn't cause pain, so that you don't have to live with back pain or fear of deadlifting anymore. Just hair that dog eventually and get yourself to a fitness athlete course. And I don't care if you start with our online course because you feel like that's more approachable. We have a level 1 8-week course entirely all online. You can take it from your couch. Our next cohort for that starts March 2nd. So if you want to jump in, March 2nd is your next time to do that. But if you want the live experience, I want to put my hands on a barbell and I want to be coached by someone who I trust that can coach me, find us at a Fitness Athlete Live course on the road. And we've got a bunch of locations coming in 2026 with a few more that are yet to hit the calendar. And I'm always open to fly to you. If you want to host a course, I'll come to where you're at too. We can make that happen. And free resource. You mentioned the remom earlier. If you're a therapist listening and you're like, Paul talked about a remom and every minute on the minute, we have a free ebook that will explain all of that in addition to a online lecture that I did about the remom. And all you have to do is follow our fitness athlete page. So if you just Instagram fitness athlete at Ice Physio, you'll find our page and you'll find our post about the free remom giveaway. And you just find that post and comment remom and you'll get the ebook and everything is sent for free. So you totally free resource. If you don't want to take our coursework, that's totally fine. At least check out that ebook.
Hell yeah. Last thing I want to say is, our little podcast, there's some really slick like AI, like hooks and little segments. We're going to do the baby one for this because I've only known Mitch as having a fully developed lumberjack beard. So we'll make this a hook right now. We'll see. Does baby Mitch have a beard? Baby Elli had her little nose ring.
That was sweet.
Baby Paul was waving his finger around the whole time. So I think that was a miss. But I mean, we'll see what happens.
Baby with a beard.
We'll see what happens there. But again, thanks for being on, Mitch.
Thank you guys. This was fun. And I'm open to do it anytime.
Hell yeah. Catch you guys in the next one.
Thanks.